Good morning. Welcome to this video. I'm Dr. Kevin Smith, and this video is on the how not to fall for the drug and surgery trap. I have been in practice since 2001. I'm a Pittsburgh chiropractor, and I wanted to share with you some really good information and things that I've learned over my past 24 years being in practice. Some things that I've learned over the years, and these are things that I see over and over again, and I just wanted to share them with you guys. So the first thing I just want to mention real quick is that I'm not anti-drug. I'm not anti-physician. I believe that drugs have a purpose. Surgery is a purpose. There's a time and a place for all healing. These types of therapies certainly have their time and place. And when it comes to helping people, they can save a life and they can improve the lives of millions and millions of people. However, I believe that as a people, we are over medicated. And I want to share with you some ideas and insights that I have learned about how to get rid of certain chronic health problems, such as joint pain and other types of issues that have been plaguing millions of people over the years. We live in a drug culture. And the drug culture says that if you have a problem, that the first thing that you typically are going to want to do is reach for a medication, whether it's over the counter or it's prescription strength. And the medical doctors will give you things like anti-inflammatory medications or cortisone injections or muscle relaxers or some kind of a narcotic. And the problem that I see with that approach is that it doesn't correct anything, especially when it comes to chronic joint pain. Let's say, for example, that you have chronic knee pain. The Tylenol or the cortisone or the muscle relaxers that the doctors give you doesn't actually fix the problem. It relieves the symptoms temporarily, but as soon as you stop taking that medications, invariably the symptoms are going to come roaring back. We live in a drug culture, and the psychology is that if you have a problem with, let's say, back pain or neck pain or knee pain or whatever, you have to reach for some kind of a chemical to alleviate that symptom. And then if the drug approach doesn't sound very good to you, surgery is going to be even worse. Surgery has a very, very poor track record of fixing things. Now, if you have a broken bone, if you have a compound fracture, or you need to have your joints corrected by a doctor to save a problem, to save an issue, I totally get it. But when it comes to chronic degenerative things like back pain or neck pain, or if the doctor wants to do a fusion or a microdiscectomy or a laminectomy or something like that, typically they have an extremely poor track record. 50% of the people that undergo surgeries get better. Okay, 50% of the people that get these procedures get better. The other 50% of the people get worse. They develop scar tissue formation. They develop a problem called post-surgery syndrome. Post-surgical syndrome. It's a degenerative problem where you have worsening pain as a direct result of that surgery. So if the drugs don't fix anything and the surgery doesn't really help much, what is the solution? What can you do if you have chronic joint pain, whether it's your hips, your back, your shoulder, or whatever? The most effective solution for these types of problems comes in the form of three things that are typically done simultaneously: chiropractic care, rehab, and nutritional therapy. So let me explain to you what these three things are and how they are going to improve your function. Chiropractic care is there to take the pressure off of your nerves in order so the nerves can flow better and they can go to their destination and make things work correctly. So, for example, if you have low back pain, the nerves that come out of the low back, most of the time they are under tremendous pressure. That pressure may cause pain or it may cause dysfunction to the muscles or to the other types of tissues that are involved. And chiropractic care allows the body to heal itself. And it depends on how bad your problem is how much care that you're going to need. Not everybody needs to come in 3 times a week for the rest of their entire life. For all chiropractic care plans, there's a beginning, a middle, and an end. And a good chiropractor will do a proper evaluation and a workup and find out exactly what you'll need. The second thing is rehab exercises. Now, rehab exercises are designed to stabilize and strengthen the connective soft tissues of the spine or of the extremities. So everybody has a unique problem, and we need to define exactly what your unique needs are and give you a care plan that is custom designed for exactly the problems that you're presenting with. And then lastly would be nutrition. Now, nutrition comes in the form of taking certain supplements to A, reduce inflammation, and B, to accelerate the healing process so you can get past your symptoms and get on the road to feeling better again. If you like this video and you want to get more of it, please hit the like button, subscribe to my channel, and hit the notifications button so you get notified when I'm able to release more videos, more content. If you have any questions, please feel free to reach us at visiting chronicpa.com. That's www.chronicpa.com. Thank you very much for watching.